Member for Courtenay-Comox.
Honourable Speaker, I rise to the motion to speak to the motion put forward by the member from Prince George Valemount and thank her for the opportunity to talk about how government investments can provide the best health care we can for British Columbia's women and gender-diverse people. I know that discoveries continue to give us new ways to help people live their best lives. I also know that our government continues to make important health investments to take advantage of providing the best care we can in a public health system. And I know that that includes addressing inequities in British Columbia's healthcare system to promote gender equity. There's a broader precursor to good health too. The social determinants of health are reflective of all that government could tackle to improve health. So what have we done? Well, we reintroduced a robust GBA+, that's Gender-Based Analysis Plus, back into government after a gender lens requirement for cabinet submissions was removed by the previous government. We're ensuring every government initiative advances more equity for women and gender-diverse people, including in health measures. Income reflects women's and gender-diverse people's health. We reintroduced and are advancing childcare to become a core service that women and primary caregivers can rely on to be able to join the workforce and provide for their families. This, after a decade and a half of falling behind after the previous government's cut of a growing, safe and affordable childcare program. Along with childcare, minimum wage has been raised to be more reflective of making ends meet after the previous government did things like introducing a training wage lower than minimum wage. Imagine today's new women workers having to accept a 25% wage lower than the minimum. Social vulnerability is another determinant of health. We have brought back sexual assault centres cut by the previous government. We're supporting survivors of gender-based violence, which is so prevalent in BC. Increased rates of depression, PTSD, brain injury, sexually transmitted diseases, unwanted pregnancies and pregnancy complications, and tragically, sometimes death. These are all bad health outcomes that could be avoided or mitigated with proper supports. And that's what we're doing. Let's also look at some of the direct health initiatives our government has undertaken to improve the lives of women and gender-diverse people. Reproductive health is being supported with free access to contraception, an abortion drug that preempts surgery, gender-affirming surgery for trans people that's closer to home. Take-home HPV tests for cervical cancer screening, and a single cycle of in vitro fertilization. I'd like to share the words of Tasha. She wrote about how incredibly amazing she thinks the funded IVF announcement is. She went through the agony that is experienced by 1 in 6 Canadians and how IVF can overcome the debilitating circumstances of infertility. She says, the heartbreak and unpredictability of infertility can be all-consuming when you're in the middle of it, but every single doctor's appointment, invasive procedure, and all the tears were worth it when I got to see my boys' little faces and have the privilege of watching them grow up. Maternal health is an important priority for our government. Last year, capital investments began expansions to the Burnaby Hospital redevelopment and the expansion of Caribou Memorial Hospital to respond to maternity and women's health needs in those regions. We're expanding the midwifery program with 70% more seats at UBC for new entrants and internationally trained midwives. When I had my kids, midwifery was illegal. Today, more and more choose a midwife, especially here in BC. In our cancer care strategy, we're taking meaningful actions to reduce cancer rates and increase health outcomes. We added $440 million in 2023, and Budget 24 would add a further $270 million. One example is supporting timely breast cancer care while we build capacity at home. Better than long wait times for treatment and greater risk of poor outcomes. As always, there's more to do, especially in healthcare, and speaking in this House previously, I have highlighted the contributions that women have made in this House. contributions that help change the lives of women. It's clear that the strength of 29 women on government side and also a majority of women in cabinet is showing how the voice of women has and will continue to be acted on. Thank you, Mr. Speaker.
Thank you, Member.